I'm Dr. Faith Cleanser. I'm an ER doctor here in San Diego, and I work for and with various nonprofit organizations and dedicate my time doing the best I can here. But yeah, I'm the daughter of two immigrants who came here to the United States 40 some odd years ago, and now am really living such a wonderful life because of the sacrifices my parents have made and the hard work that they put into living here. And they were able to come here safely and build lives for themselves. So I'm very proud to be here and to present our immigration attorneys here to help us out with the current policies that are affecting our patients in the emergency department and in general impacting healthcare. I'm one of the moderators here along with Juliana.
Hi, everyone. I'm Juliana Jaramillo, an emergency medicine and pediatric emergency physician down in North Carolina. We are both part of the Latin American Hispanic Health and Education Committee through AAEM, and we were very excited to get these two great immigration lawyers to join us today. If you want to go, Faith.
Yeah, so I'd like to introduce Astrid Gonzalez Whalen, who's an immigration attorney and a solo practitioner who's dedicated to defending the rights of immigrants and advocating for family unity. Her practice focuses primarily on removal, defense, and family-based petitions, where she brings both legal expertise and deep empathy to her clients' cases. She was born in Venezuela and has immigrated to the United States in 2001. Her personal journey fuels her passion for human rights and justice. She is fluent in Spanish and has a strong commitment to serving immigrant communities with compassion and integrity. And before entering the legal field, she spent 9 years in high school and middle school as a high school and middle school teacher after earning her bachelor's in history secondary education from Appalachian State University. Her experience as an educator has shaped her client-centered approach and sharpened her ability to communicate complex ideas with clarity and care. Astrid earned her Juris Doctor from Campbell University School of Law. Today, as a solo attorney, she brings tireless dedication to her work, believing that every individual deserves a fair chance and a voice in the legal system.
And then we also have Elena Barrios, who is a 2024 Immigrant Justice Corps fellow with OLA of Eastern Long Island, which provides direct legal services to Spanish-speaking immigrant communities in remote parts of New York. She's a graduate of William and Mary Law School, and she has worked a range of immigration matters, including asylum, T visas, and special immigrant juveniles. That Immigrant Justice Corps is the first fellowship program dedicated to meeting the urgent need of high quality legal representation in immigrant communities. And OLA of Eastern Long Island is a nonprofit offering advocacy for Latino immigrants with a strong focus on bridging access to legal services, healthcare, and other essential services. So with that, I would love them to take it away and provide us with their presentation. And you guys can go ahead and if you have any questions throughout the presentation, put it in the chat. And if you don't want it to show up there with your name, feel free to either message me or Faith directly or even directly to Astrid and Sara and Lina, and we can just read through your questions.
All right. Thank you all for being here. I will be taking on the first section of this presentation that is ICE in the ER, know your rights and responsibilities. We know that.
We really need you to mute yourselves, though.
I don't know, Katie, are you able to hear us and mute yourself?
Sorry, you know what? Doctors right here.
I don't know if we're all going to be able to do that. But just as a disclaimer, unfortunately, this webinar is going to cover a very specific area of immigration law, which is when there is ICE enforcement in the ER, and it will not have all the answers nor be legal advice. Every situation is very different, so we encourage you to contact legal professionals in your area with any specific questions. There will be resources on how to do so close to the end of the webinar and on the slides when they get sent out, so you'll be able to access that. So this is just our effort to set the scene where I'm sure that you're all very aware of all of the changes in immigration policy. Maybe you've seen how they affect your ER at the moment, but there are many fear tactics imposed, and individuals are skipping medical care. They're fearing ICE. They're fearing getting medical care that they're entitled to. Yeah, I don't think we're able to do anything about the interference, are we?
Katie, where's he going?
I'm trying.
I just know how.
Every question.
Again.
Or others. Go over the patient. No, where'd they go? This is 4141. Something else. Look.
You think we should just continue on?
Yeah, you can continue on. It's fine. We'll try and get a hold of Dr. Vest to see if she can. She's obviously working the ER.
Okay, so we can continue. And throughout my sort of section of the presentation, anything that I reference, or if you want to know more information about any particular slide, there are going to be sources hyperlinked at the bottom, again, when they get sent out. So we want to make sure that you're aware of things going on in your ER for individuals who have uncertain status or maybe family members with uncertain status in the event that there are any attempts at immigration enforcement. For the next slide.
Right. He's a 47-year-old now.
And thus our goal is more basic than going through a hypothetical situation that could happen in an ER across the country. Our goal in this presentation is to empower you. It's to empower you to ask the right questions in your situation. Make sure you feel secure in your hospital's policy or in your clinic's policy should an enforcement action occur. Secondarily, we're also seeking to empower you as individuals to keep immigrants' rights and protection a visible part of your emergency room and your approach toward patient care. Keeping in mind that even if ICE follows every rule that's in front of them, the fear that they still impose on patients can be life-threatening, and your care for your overall well-being as their physician or as their healthcare provider should be verbalized.
It's on their complex. It doesn't have a history of you
Poll questions for you all, just to get a sort of pulse check how we're doing and your experience with immigration policy in your ER. So I believe that you should be able to, if you have a device, scan that QR code and you'll be able to questions for you.
Well, I'm like, sure. He like looks and come to work. He's like eating first let's localize it. And he's like stay forward and like
How are we doing on the poll?
you get into what? Oh, sorry. It looks like he's not eating the part. And it's like what
The poll's loading up.
all right, sounds good. Thank you.
All right. Here we go.
Yeah, absolutely. Yeah, thanks.
All right. If everyone can just take a second to answer those so we have a better understanding of who's here and what your experiences with ICE have been. And then it's going to put it out there that anyone on should be muted and that you should double check that your microphone is muted.
I don't know about everybody else. I can't seem to get it to work for me.
Okay. So we can just do like a raise of hands situation.
I think it should work now. It
Yes.
had been deactivated.
Awesome. Thank you.
Yay. Thank you guys for participating. And I hope the sort of white noise of the ER is soothing to everybody in the background.
Yeah. And at least you know what it's like. The craziness, the busyness, and how half our meetings, we're really multitasking here. We're like trying to be everywhere all at once.
That's right. It's a learning experience for physicians and attorneys alike.
Yeah.
Yes, we have a question.
Just tomorrow.
What the year long?
Can we see the results of the polls yet or not?
Yep.
All right.
Yeah, the whole.
Okay. So we've got 100% yes in terms of people using ICE in their ER. This is 100% of patients have expressed fear of ICE showing up in the ER. 100% of people here have seen that or heard that. Huge. The next one. All right. So we know that there is a plan in place for at least for attorneys here if ICE shows up. This is good to know. Go ahead. Excellent. Okay. I'm glad that you don't feel unsure of your role if you do have to interact with ICE. Hopefully we can bring some clarity and some additional clarity. And so we have the legal team has not passed on any information or trainings for possible interactions with ICE. Glad that we can be here and hopefully answer some questions or give you the right questions to ask.
I'm pulling up the presentation back up again. So
Sounds good.
give me space. Okay.
No worries. Okay, this is going to begin the section where we're going to do a little bit of a legal landscape overview. This is a picture, and again, linked below, of the memorandum that rescinded all of the protections for near protected of the protected areas that the Biden administration had in their DHS or Department of Homeland Security policies. This would create concerns with patients and it may delay necessary care because it allows ICE to enter hospitals and it doesn't keep them as apart from other places like schools that people may have seen in the news of ICE enforcement at schools, ICE enforcement at courthouses. All of these places, again, including hospitals, are no longer protected. Thankfully, though, since March 13th was the last time that this was checked by a source, there were no confirmed reports of ICE in doing enforcement engagement in hospitals. But obviously, this can change. This changes really quickly when there are new directives from this administration. So it's always good to be prepared. There's also linked, I just wanted to highlight, the National Immigration Law Center has a little bit of a fact sheet about the Trump rescission of the protected areas policy and what that means. So again, if you want more detailed information, please click those links. And then in terms of the intersection of privacy rights and immigration status, generally, there is no affirmative obligation for physicians to ask or report about immigration status. I'm sure you're all very familiar with HIPAA, and this shares that healthcare professionals are not obligated to provide protected health information unless there's a judicial warrant or a subpoena. Something that's coming up now with the new administration is a legal argument that immigration status is a protected health information, like it falls into that definition, because it relates to the past, present, or future physical or mental health or condition of an individual. But this is not settled law by any means. But if you're interested in the legal argument, again, you can find that at that source linked below. And overall, again, there's no general affirmative obligation. But if we go to the next slide, the most important thing, there you go, is to check your state. So I am in New York. Astrid, I think you're in North Carolina right now.
Yes.
There you go. So we can offer those specific points of view. But there are 2 states in particular that have requirements now to inquire about an individual's immigration status. Those 2 states are Texas and Florida. On the left-hand side, we have the Texas executive order signed by Governor Greg Abbott and the Florida bill signed into law by Governor DeSantis. These states are requiring hospitals that receive federal funding to ask about immigration status, while also explaining that the answers to those questions won't affect patient care. Supporters of these bills claim that this information will only be used for reporting purposes. However, on the next slide, I'll let you all hear from Representative Alma Hernandez as she spoke about a similar bill from Arizona.
Let me know if the audio works, okay?
This is a topic that has been brought up a few times. Congress has seen similar legislation, but I just want to say something as
I think we lost the audio there.
So I did it all.
We can put that on pause. Essentially, Representative Hernandez just makes a very impassioned and I thought beautifully stated point about how this information, although supporters, like I said, claim it's only used for reporting purposes, collecting information on immigration status does harm communities. It just creates even further of a chilling factor for individuals to seek the medical care that they need. It affects communities that are already just wrapped with fear, wrapped with concern for their loved ones. And after this bill did get passed through Arizona, it actually just got vetoed just a few days ago by Governor Katie Hobbs. So this is another plea to senators, everything that you've heard over and over again, but these things really do make a difference. And we do see some really great people trying to defend immigrants and protect their right to healthcare. Okay, and the last little bit that I will talk about in terms of overall legal protections is the Fourth Amendment. The Fourth Amendment, this is the language of it, in case you wanted to go to law school for a little while. So we have the right of the people against unreasonable searches and seizures shall not be violated and no warrant shall issue, but a probable cause, and particularly describing the place to be searched and the persons or things to be seized. So this is a protection for individuals, not just citizens. Any individual can exert their Fourth Amendment protections, and basically means that a government actor generally needs a warrant to enter a private area. One of the sort of flashpoints on Fourth Amendment protections is the question of what is a public area and what is a private area. Something's in a public area. It can be something like sidewalks outside, if we're talking about specifically in a medical ER situation. Parking lots, it's all on a spectrum. So as we go further along, we're getting more and more private. Parking lots, lobbies, waiting rooms, hallways. Then we have something like a curtained off patient room. Then we have a patient room with a door and a lock. So as you can all see, we get more and more private. It feels more and more clear that this is an area that's not for the public eye. It's not for police officers. I wouldn't want my neighbor walking down the street and just happening to catch me in my patient room with a door that's locked. One of the ways that hospitals can strengthen their Fourth Amendment protections, or any location for that matter, any individual, is to have signs, really clear, specific signage that says that things are private areas when they're not. You can have clear policies within your institution that separate private areas from public ones. Some things that may be common are check-ins or visitor passes. If there's an area that you need a visitor pass in, that's likely not going to be a public area because you've had to get your identification taken or people have to know who you are, what your connection is with a patient. So these are a few things that are policies for an institution that can be useful. Additionally, there is a real need to keep confidential information out of public view. My mom is actually an ER physician, so I understand what it looks like when everyone is in the ER. You've got all types of charts, everything's out, you got big computers. But just be aware if there is any concern for ICE enforcement, things that, having a window up that if you're collecting, you happen to be in a state that's collecting immigration information or anything like that, just make sure that those windows on your computer are down, those papers are turned over potentially, just so that somebody can walk by, an ICE officer can walk by and see them. But the other part of the Fourth Amendment, which I will let Astrid take, is the importance of recognizing what a warrant is and when you have to follow it.
Great, thank you. So something very important to keep in mind is the documentation. Like this is key right here. So you need to understand the distinction between a judicial warrant, which is signed by a judge or a magistrate, and an ICE administrative warrant, because they do not function in the same way. So this is very important, especially when you're in a place like emergency departments where legal compliance and patient rights are key. So here we have what you should be looking for in a judicial warrant. Because for a judicial warrant to be legal, it needs to follow certain steps. It needs to check off certain boxes. So it does authorize law enforcement to conduct a search, a seizure, or arrest based on probable cause that a crime has been committed. Key here, it needs to be signed by a judge or magistrate. You always want to look for that signature. So that it's authorized by a federal or a state court based on probable cause. But the scope is really important because just because law enforcement has a judicial warrant does not mean that they can just do whatever they want with this person, right? You have to read the warrant to assess what the scope of it is. Then we move on to what an ICE administrative warrant is. It's issued by the Department of Homeland Security for immigration enforcement purposes. So you have ICE, sometimes CBP, other agencies could issue one. It's signed by an ICE or DSH officer, not a judge. These officers are not always attorneys, by the way, so mistakes can be made. It's based on civil immigration law, not criminal law. And it typically directs the law enforcement and arrests in expected violating immigration law. Why? When it comes to enforceability, it does not grant authority to enter a private property without consent. So something that, for example, I tell my clients and other immigrants, if ICE comes in and they have a paper, if it's an ICE warrant, you do not have to let them in. And they can show it to you through the window, they can slip it under the door, but they're very different. So here we have some examples of a judicial versus a DHS warrant so that you can see some of the things that you can look for to determine where you are with this. And what that tells you is what that law enforcement agent can do and can't do. So next, I wanted to talk a little bit about what happens if ICE does show up in the hospital or wherever it is you're working. What can you do to prepare yourself and your staff? So creating a protocol is key to make sure that everyone knows what to do so that they are informed. The last thing you want to do is leave them uninformed. So you want to make sure that you find a person that can be a liaison, like a point person that is going to be aware of the protocol and the relevant law. Train your staff on how to manage the situation, and remind your staff that if they're not the point person to deal with ICE, then to avoid these interactions. Establish a chain of command. ICE comes in,
who do we inform, run training drills, simulations, so that people can understand how it plays out in real life. Especially the front desk staff or greeters, they should be aware of this. So if they do see ICE comes in, they can notify the person on point so that the hospital is aware of how to handle it. Some recommendations that I saw online were to create a special code, so code grade or whatever color you want to choose. That way you can alert the staff without them having to discontinue their work. If you really, and I know that we have people here from a variety of perspectives, right? The Know Your Rights trainings, they have been happening throughout the country. Attorneys and non-attorneys have been putting these together for communities. So there are some good resources, and here's a link to them. And I believe this link has it in like several language, over 20 languages. So you can look at that if you're in an institution where perhaps you can even make this material available to patients, then I highly encourage you. I printed out these red cards that I give to my clients to hand out to ICE if there ever is an encounter. You can make these materials if possible. I know that right now the climate is different, but if you feel comfortable, you can make them available in break rooms or staff lounges. And you want to train the difference between a warrant. You want to refresh those HIPAA rules and the particular protocol that you're going to follow. But policy is only as effective as the staff who have to follow it and impose it feel like they are being supported by their superiors. It's an ideal scenario. You are an institution that is going to make sure that their workers feel like they're backed by their administration in upholding this policy, that they're going to feel like patient care and privacy are the top priorities. And so hopefully that is a situation that you can be in, but knowing your role and making sure that everyone knows their role is really important. It can be intimidating when you have a law enforcement officer or several come in and ask you questions. So an idea of a ICE interaction plan that we came up with here would be, what are the immediate steps? What should happen, right? So you want to alert and assemble the response team. You definitely do not want to let the officer just wander freely wherever they want. You want to verify their identity and credentials and escort them to a private area. That way they're not just walking around where sensitive information could be, like, again, we're going to that public view of the Fourth Amendment. And you can politely refuse unauthorized access. Again, even if they have a warrant, that does not mean that they can just willy-nilly search everything and grab people. That's not how they work. They're very narrow in scope. So what if they do have a valid warrant? What do we do? In my opinion, you should notify legal counsel immediately if you haven't done that already. And you want to read that warrant because you want to make sure that the actions that law enforcement take are in compliance with the scope of the warrant. Is it a search warrant? Is it an arrest warrant? It will tell you. And then document, and I am sure physicians and healthcare providers are equally familiarized with the importance of documenting things as attorneys are. So it's also wise to have a security officer or hospital administrator accompany ICE agents executing the warrant at all times. I don't recommend that you just leave them alone with patients or even the physicians or other healthcare providers. Some clinical considerations: medical stability of your patient always comes first. Again, I would say look back to those MTAL requirements, regardless of a patient's immigration status. Patient safety risk, stress-induced complications could be a factor. That's something that you might want to keep in mind. The disruption of care plans, right? What if you can't finish providing the care to its full? You want to make sure that you document incomplete treatments or pending care, you want to make sure you provide a summary of care to ICE medical staff if possible. Ensure safe transfer of meds, wound care instructions, etc. And really do think about the impact that this could have and that is having on vulnerable populations, right? So you're going to have patients who are minors, who are elderly, pregnant, disabled, or mentally ill. So pediatric considerations, you may need to engage social services or child protection. You might have a U.S. citizen child that's receiving care at the hospital, but the parent or guardian is an unauthorized immigrant, undocumented. So it gets complicated. We have a lot of mixed status families. And consider the risk of acute psychiatric decompensation for a patient who is mentally ill. So things to keep in mind. Also, consent and capacity issues. Can the patient actually make decisions? Do they have the capacity for decision making? If your patient refuses to speak to ICE and requests a legal counsel, then you want to make sure that you document that. The continuity of care after removal. This is really tough, right? Because it's how can I do that? They're not coming back. I don't know where they're at. The best you can do is to try to provide ICE with as much of the record as you can. And you want to make sure that, again, you document. Privacy and confidentiality, again, remember HIPAA. Document any requests of information by ICE and how the hospital responds to ensure legal compliance. And the last point here, which I think is actually extremely important, is trauma-informed care. So a lot of undocumented immigrants have past trauma. So you want to keep that in mind. They might have past trauma with immigration detention. They might have past trauma involving law enforcement, all of those things. So approach these interactions with sensitivity. Maybe think about getting a social worker or a patient advocate involved. The language and accessibility. I recommend having signs in 2 to 3 of the hospital languages, whatever your location is. I spent a lot of time in Miami with my practice, so Spanish and Creole are probably the 2 most common languages that you will see in public spaces. And importance of interpreters in legal rights conversations, like make sure that you get someone in there, like an actual interpreter to help communicate with that. You should come up with a sample ICE arrival protocol with clear instructions, coordinate with your hospital security and police, but also you want to be aware of the 287G law enforcement agreements. And this link right here takes you to the DHS website that has the latest jurisdictions that have agreements between local law enforcement and ICE. Okay, so we have a hypo here. Elena, would you like to take over the hypo part?
Sure.
Okay.
Read it.
Yeah.
So it's at 9:30 p.m. on a Saturday. Maria Gonzalez arrives at Metro General's ED, a cutter. She's visibly anxious and in pain. The triage nurse notes her limited English proficiency, Spanish, and an interpreter is called. Maria reports worsening abdominal pain for 2 days, fever, and difficulty breathing. During the initial workup, she reveals her undocumented status to the interpreter but requests privacy. Labs are drawn and imaging is ordered to rule out appendicitis or sepsis. At 10 o'clock p.m., Agent Thompson from ICE enters the ED lobby. He states he's looking for Maria Gonzalez, suspected of an immigration violation, and requests to know her location and medical status. How should the staff respond?
And if people want to raise their hand or comment on the chat, that would be great.
And even just one idea is good. We can do sort of group brainstorming session. Okay, we have in the chat, we have asked for a warrant. Excellent first step. Refer the agent to your supervisor. Absolutely. If there is a designated person.
I'm driving, so I can't respond to the chat, but I would also recommend informing them to know that if she was there, providing that information would be a violation of HIPAA in regards to telling them about her medical condition and stuff like that.
Yeah, absolutely. Keep those lines really clear on what your role is with patient privacy. And keeping in mind, just like Astrid said, it can be really intimidating. Like maybe that first time that you get an ICE officers are notoriously persuasive in ways that are perhaps ethical and unethical. So they may just casually ask. They may not look like an ICE officer. They may walk in plain clothes. So yeah, staying aware of keeping HIPAA at top of mind if anyone's asking about medical status.
Yes, and I would like to add, like Sayalena said, we have gotten a lot of reports of ICE officers just detaining people or attempting to detain people wearing plain clothes, not a uniform. And they will use very sketchy tactics to try to get a hold of a person. I had a client who was recently detained and he was just in his apartment. They want to open the door, and the ICE officer who was dressed in civilian clothes said, "Oh, your car has a flat tire. You need to come fix that." And the person stepped out, and then they detained them. So you want to be aware of that. And also the front desk staff, you want to make sure that they don't become intimidated by a law enforcement presence.
Yeah, so we have a sort of a clarifying question in the chat, but just a really good issue spotting, which is key for any sort of legal analysis and really important to ask, is the ED considered a private space? So there's a lot of different parts of the ED. We mentioned this, it's going to be in the slides, but keep in mind, we go all the way from the sidewalks outside, which are probably the most public. That's considered part of the ED. But then we have the lobby. Then we have the floor of the ED, which some patients are outside in the hallway potentially. Some patients are in rooms that have curtains. Some patients may be in rooms that have doors and locks. So there's a lot of different areas of the ED and where you want to be considered a private space kind of as soon as possible. Even it can just be a paper sign. It can just be something really simple that's stating to ICE or stating to any law enforcement that this is a private area where they're not allowed access. It's just simply not for public view. Really good question. And the way that the hypo is phrased, he enters the ED lobby. Does anybody else have to show ID to get into that ED lobby? Do people have to check in? All of these would be questions as to whether or not the ED lobby in and of itself is a private area. All right. And I also wanted to mention on the ask for a warrant, make sure that you're reading that warrant carefully. Just like Astrid mentioned, make sure that somebody, if you're unclear, call your legal team, call somebody to look at it with a fresh set of eyes, especially if you're stressed or something going on. You're in the ED, so you're probably always stressed. I've seen 2 episodes of The Pit. Make sure that you're calling in backup when you need it. All right. And then does anybody have any other questions that we have not covered? Please feel free to either unmute or ask in the chat, and we will hang out for a bit.
I have a question. Do you have a list of immigration lawyers, nonprofits who are willing to take up cases? Like a network?
Yeah, I would just go to the next slide, Astrid, if you could. So this is before we can also answer your question, Dr. Schwartz. This is the first slide here is key resources. Both of these articles have really excellent summaries of some of the things that we've covered here. So if you're looking for like a 1-pager or 2-pager, those are great. But in terms of legal resources, 2 places to look. Again, this is a national webinar, so it's a little bit hard to give specific recommendations or advice. But the Immigration Advocates Network will include, I believe, nonprofit and paid immigration attorneys or organizations. And then the American Immigration Lawyers Association, AILA, has a private attorney lookup for anything immigration related. And it's a really great organization, really well known and really well respected within the immigration community. Astrid and I will be at the conference coming up. And also the Executive Office for Immigration Review, which is just immigration court generally, has some resources for immigration legal services that clients don't have to pay for. So all of that is linked. So hopefully that is helpful as at least a first step in individuals looking to either refer patients to legal services that are low cost or no cost. Or if individuals here, and like I said at the beginning, immigration law is vast. So there may be questions about visas or employment visas, student visas, your colleagues or anyone else who's unsure about their status, DACA recipients. I really recommend that you look at the AILA attorney lookup, and they can give you a dedicated immigration attorney can give you a really great analysis of your specific case.
Yes. And also with AILA, they do have some pro bono services. So we do get them on the listserv at times where people are like, is there anybody available to take this case pro bono or low bono? So even reaching out to some of those attorneys can be helpful. Okay, I believe we have a question in the chat. If a patient is in a public space in the hospital, can I tell them to walk into a private space? Will I get myself in trouble?
So this is a tough question. And I think it's, as you can imagine, going to be really dependent on the situation. I don't know if anyone else has seen, there's a video going around of a huge community like throwing themselves in front of ICE cars and trying to rip individuals out of like actual physical ICE custody, like they're in ICE agents' hands. And I believe that is going to end up being a real problem for those individuals because they are obstructing justice, quote unquote. And so you can't like rip individuals out of ICE custody or really impact that. And we can't recommend that you do that. But just having a patient that you want to like assess more carefully and bringing them into a patient care area, I think is one of the least sort of offensive things that you can do. You're a physician and your goal is patient care. So I would just a word of caution if it appears that you're just doing this action to protect the individual and to keep them out of ICE custody is maybe not the best idea. But if, as usually is the case, you can say that this is in the effort to protect your patient and your top of mind is making sure that their well-being is taken care of, it's definitely more likely that's something that's okay in the eyes of ICE. But I don't know if Astrid, do you have any other thoughts?
Yeah, no, I agree with that. I think that just having moved them to a private area, like I don't see an issue with that in general, especially if it's still within the emergency department. Like you're sending them somewhere else in the hospital to hide them. And I would definitely not recommend guiding them to leave the hospital in a way. Even judges can get in trouble for that, apparently. Yeah, but if like I don't see an issue with that, like intent is the operative word here. If your intent is to provide your patient with privacy so that you can give them the best care that they can get, then I don't see a problem.
Okay, and then we have another question that was submitted privately. We have, as long as it is a patient care area that is considered private, ICE cannot enter unless invited, correct? But that would not apply to an ED lobby. So 2 parts. It seems like the patient care area, ICE cannot come, that's correct, unless invited in, or you're able to make the argument that it's a private area and it's not public, so ICE should not be able to enter. And the ED lobby, you would have to have some pretty clear signage, in my opinion, to make the argument that is a private area. Feel free to do that as much as you can. Have a visitor's sign, have a check-in desk. But I think it is a much harder argument to say that the ED lobby is a private area.
Definitely.
All right. Do we have any other last minute questions? And thank you. I also wanted to shout out in the chat we have for people in California, Grant has written in that in San Diego County, there is an attorney who offers immigration legal services with San Diego County World Relief. So check them out if you're in the area.
Any last minute questions? We have 6 minutes. If not, we can wrap things up. And yeah, thank you so much to Astrid and Sarah Lena for your time and your information. This was extremely helpful and for my work, especially. And I'm sure there's all kinds of burning questions. So hopefully we can have more sessions like this in different contexts. Because I know some of our audience here don't work in the emergency department, but they work maybe in healthcare or in public health or in education. Definitely we'll all be looking through your legal resources for more of that information to see if there's some information that could be recontextualized. But a lot of this can be recontextualized in different situations that I've listed. So thank you so much.
Great. Thank you for having me. I enjoy this opportunity.
Yeah, thank you very much.
Thank you guys. All right. Take care, everyone. Thank you.